And it's 10:02. We'll get started. Good morning again. My name is Sophia May Smith, and I am the CRC for Region 4. And today we'll start our meeting with Heather Norton, our Assistant Commissioner, who will talk to us about the current updates for the Department of Justice program. Heather?
Hello, everybody. Thank you for joining us today for the Provider Roundtable. I'm just going to give a brief update around the Department of Justice Settlement Agreement and the status of that. Some of you may have heard that the judge entered an order to extend the agreement for an additional year, and also postpone the contempt hearing till January. I think it is actually scheduled now for January 29th. Attorneys from both the Department of Justice and from the Commonwealth have an opportunity to respond to the judge's order that we received earlier this week, and have 7 days to respond to that. So I know that the Attorney General's office is meeting with the administration today to determine next steps for the Commonwealth. And we will be paying attention and going from there. Any questions I can answer?
Heather, I'm sorry to interrupt. If everyone is not on mute, please make sure you're muting. Apparently they're getting some echoing and it's hard to hear. So I apologize, Heather.
Or I just muted everybody, so there's that. So with that, I'll just double check. Are there any questions about the status of the settlement agreement or information that you would like from me before I have to bop off and attend another meeting? All right, not hearing any questions from anybody or seeing any questions in the chat. Oh, wait, somebody has their hand raised, so let's go ahead and do that. If I could, Yvette, if you want to go ahead and ask your question. Okay, that's a good question. What is the settlement about? So let me just thank you, because, we sometimes assume that everybody knows what we're talking about when we talk about the settlement agreement, and I recognize that that is not necessarily the case. So the Commonwealth is in a settlement agreement with the Department of Justice around services and supports for individuals with intellectual and developmental disabilities, and ensuring that they have access to the most integrated supports and services. As part of our settlement agreement, we have 121 provisions that are written into that settlement agreement that ask us to do things such as assure that individuals are living in the most integrated settings, have access to community supports and services the way that they would like. And then back in January of 2020, we also negotiated 327 compliance indicators. Those are either process indicators or metric indicators that we are held to be responsible to in order to meet those metrics and those expectations. And with that, we have to produce data and reports related to that information. And so where we're at now is we are currently in compliance with about, let me see if I can do this from the top of my head, 222 of the 282 indicators. So you heard me say before that there were 327. 10 of those roll up into a primary indicator, so that's 317. And then in July, the judge, in our case, relieved us of 35 indicators, which left us with a remaining 282 indicators. And of those 282 indicators, we are in compliance with 222. And then there are 60 that we are not currently in compliance with, that we need to come into compliance with in order to meet the requirements of the agreement. Those indicators include things such as making sure that individuals have access to nursing supports and services, that individuals have access to behavioral supports and services, that providers such as yourself are implementing their quality improvement programs as well as their risk management programs. And we collect data on a variety of different things related to all of that and share that information through our Department of Justice settlement agreement, specifically on the library that we've created related to that. All right, are there additional questions? All right, not seeing any additional questions in the chat or anybody else having their hand raised. I am going to hand it back over the team so that you can get through all of the phenomenal presentations I know that you're going to have today. And I'll hang out for a little bit in case anybody wants to put any questions in the chat.
Thank you, Heather. And for those of you who have just joined us, we are started our provider roundtable, and we're asking that you put your questions in the chat. And if you think of questions for Heather, please do so, and we will combine those and get answers back out to everyone. Next, we have supported decision-making, Eric, with Sarah Thompson. Sarah?
Yes, hi everybody. So this is just a quick update. If you have not been to our page yet on the DBHDS website, there is a web page specifically for supported decision-making and supported decision-making agreements. And one of the new pieces that we've updated is we have a document on that helps with decision-making options. So there is a breakdown on what the different options are in Virginia and what you can and can't combine. There's also a training that's been done. It's recorded along with a copy of the PowerPoint. It is the decision-making options training. So if you use that QR code or you type in the website link that's there on the slide, you can go down to trainings and then look at the decision-making options section. Again, that was done in April 2023 of this year. And certainly if you've got any questions beyond that, please feel free to reach out to me, and my contact information is on the website. Thanks, y'all.
Thanks, Sarah. Moving along, we have therapeutic behavioral consultation, quality assurance information with Nathan. Nathan, good morning.
Hey, good morning, Sophia. Good morning, everybody. Great to be here. I'm Nathan Hobble. I'm project manager here in the Division of Developmental Services, and I'm the agency's lead for this particular service as well. Go to the next slide, please. So I'm just going to give a quick update on these two areas that we're working on related to several compliance indicators under quality assurance and getting people connected to the service in a timely manner. So to start off with quality assurance, many on the call are probably familiar with the measure that we've created that's called the Behavior Support Plan Adherence Review Instrument that we drafted to determine adherence to practice guidelines that went into effect in July 2021. So that particular tool uses a weighted scoring system. The criterion for being overall in adherence with the practice guidelines is 34 or above out of the 40 possible points that are on that weighted scoring system on the tool. If you're particularly interested in looking at the most recent review from the independent reviewer and his consultants, you can look at the 22nd study period report. I can also put a link to that in the chat when I conclude my discussion here. Just some recent snapshots on the data of where we are. Our goal is to get 86% of the programs that we review in adherence with the practice guidelines. The most recent data was at 49%, which overall is improvement over time. When we first did a batch of reviews, we were at 13% of programs that were reviewed in adherence with the practice guidelines, so making progress. And then just to break it down a little bit further, the last batch of reviews that we did, it was 120 plans. The scores ranged from 12 to 39, and the average was around pretty close to 32 points. And then the median, that middle number, was at 33 points. So I'm just going to hold my hands up. And if you think about what a bell curve looks like, the bell curve is going this way. If this is a 0 and this is 40 points for the possible point allocations on the tool. So the fact that the median is higher than the mean means that the majority of the points on those reviews, they're closer to 40, which is excellent. I can also pop these links into the chat at the end, but the tool itself and its scoring instructions are available on our website for anybody that's interested. And I'd encourage providers that are delivering this service, if they're not familiar with it, please go check out the website. There's a lot of information there in addition to the actual tool, and you can download the tool. And some providers have told me that they found it helpful to use it to self-assess their own plans. Next slide, please. The other area that we're working on is ensuring that folks that need the service get connected to it within a timely manner. And our target metric is that 86% of people that have this need identified at their ISP meeting have a service authorization for the service within 30 days. Let me just explain the graph here really quickly because it could be a bit confusing. And I'll also try to make it a little bit bigger next time because I'm squinting looking at it here on my own computer. So we've got 3 variables on the graph. The orange line is the number of people month by month that were connected within 30 days. The blue line is the number of people that were not connected. And then the gray line is the overall percentage. The primary vertical axis, the one that's on the left-hand side, that corresponds to those numbers of people connected or not connected. And then the one that's on the right-hand side, that y-axis on the right-hand side, that's the overall percentage for that gray line. So this is over the past 5 months of data that we had up until June 2023. There's a bit of a lag in the data when we're reviewing the data. So we're able to do it about 60 to 90 days after the actual end of the month. But 75% of people that needed the service in June were connected, and that's the highest percentage that we've had since we started this measurement and all these initiatives about 3 or so years ago. You can jump onto the next slide. And just wanted to point out some information that might be helpful to folks. There's a search engine that's also available using the Power BI platform that's on the Behavioral Services website. If you're a provider of this particular service and you're not listed and you would like to be, you can navigate to the website and complete a Microsoft form that will automatically push the information over to me and to the team that I'm working with on these initiatives, and we can push that information live pretty quickly. So the automation component hopefully makes it easier for everybody that's involved that wants to be listed on the website. And if you're a person that needs to access somebody for therapeutic behavioral consultation, I would strongly encourage using the search engine. We've made significant updates to it recently where you can drill down to if the particular provider delivers the service in person in a particular CSB catchment area. So not just specific to the actual region, but all the way down to the level of which community service board they're actually delivering face-to-face services to. And there's also filters for telehealth, the type of practitioner that's delivering the service, languages spoken by the provider, all types of different things. And so I'll close with my contact information is on here. I welcome your feedback and comments, questions. Please don't hesitate to reach out to me. And my colleague, Brian Phelps, his information is also listed here as well, and you could reach out to him as well. And I'll stick on for a couple of minutes to put those links on and field any questions that come into the chat.
Thank you, Nathan.
You're welcome.
We're going to move along to the Office of Human Rights with Tanika Goldman.
Good morning. Good morning. I am Tamika
Morning.
Goldman. I have the good pleasure of being the director for the Office of Human Rights here at the department, and we just have a couple of updates, announcements, reminders. So this first slide really has all the highlights here for you, and the slides after kind of go into more detail. So moving on to the next slide, just wanted to make sure everyone was aware that we do have an interim manager in Region 2, which is the yellow one at the tip top. We have we're really excited to say that we've been able to promote within, and so we do have someone identified to be the full-time manager, and she will be announced at the end of October and the beginning of November. So just wanted to make sure you're aware that we do have the interim manager, and that information about who will be taking that position will be coming forward. Also wanted to remind everyone that we are still actively in the trenches of recruiting for a training and development coordinator. Really excited about the applicants that we've had a chance to interview and hope to fill that position before the end of the year. Which leads me to the next thing. Unfortunately, we are not able to facilitate the previously scheduled web-based trainings on the next slide. And so the trainings that we had planned for October have been canceled. I'm really sorry about the wonky way the top of the slide looks, but those lime green links take you to the Commonwealth Learning Center, which is where we're trying to put some of the modules for our trainings. And so you want to make sure that you're registered there so that once those trainings go live, you have access to that. Again, we'll be sending out information about when those things are posted, but that's just kind of for you to be prepared for that. Also wanted to let you know that we have been able to resume the community look behind, and this slide just gives you a little bit of background information for those that aren't familiar with that project. I'm also excited to let you know that we've done about 8 months of data, and so we're going to put together a memo to let folks know what we found. This is a really collaborative process with specifically providers licensed to provide DD services, and we're able to look back and see that the complaint resolution process, the abuse neglect investigation process is working in accordance with the human rights regulations. And so we've been able to identify some areas where our system could improve. And so you can expect to find a memo on our website and sent through our constant contact with kind of some updates about what we found in our first couple of rounds of reviews. Right now, we're reviewing cases that were closed in September of 2023. The next slide is letting you know that we are in desperate need of volunteers. We have 17 LHRCs across the Commonwealth that serve all of our licensed providers and all of our individuals. There are certain things in our regulations that require a review by the LHRC. And so certainly we want to make sure that those local human rights committees have the membership that they need. This is a way for you to access information. If you personally would like to volunteer on a committee that you're not taking your business to, or you have a colleague, another professional you're aware of, or especially individuals or their family members that are receiving your services that would be interested in serving in this way, you can find this information on our website, in addition to kind of a one-pager about what the local human rights committee does, as well as the actual application. And if you have questions about that contact map I had at the beginning, you can reach out to your regional manager for that. I also wanted to let you know that we've updated our LHRC review forms. So when you have a next friend appointment, when you have a variance that you're requesting, when you have a behavior treatment plan with restraint or timeout that you need the local human rights committee to review, we've updated those forms to remind you that you need to redact all of the PHI. And so the forms themselves haven't really changed. We just put some additional instructions to remind you to redact PHI. And again, those forms are found on our website. The last thing is just reminding folks about the enhancements to CRIS. And so these next two slides remind you what those were. Those changes happened in July, so everybody should probably be familiar with that. But we broke out the categories of seclusion and restraint because those are two very different things. We know that in the community, we should not be utilizing seclusion unless we're in a children's residential program or licensed inpatient setting. But then certainly there may be instances of restraint that were unauthorized that need to be reported. So we broke those out. We also added additional subcategories for neglect to try to make it easier for us to understand what those reports are, so we can be proactive in the way that we're supporting and training and helping you as providers. And then, of course, we added a category for psychological. If you have questions about the reports and complaints that you get, which category they go in, please feel free to reach out to the regional advocate, which again is on that contact map. The next slide also just reiterates that we've removed the option to select other right away, because we feel strongly that if you're entering it in, you should be able to identify which potential violation of abuse it is. Once you've done your investigation, you might discover that it is something other than abuse, neglect, or exploitation. And so you've got that option after you've done your investigation. And if you select that, it will ask you to explain. So those are the big changes with respect to reporting abuse, neglect, and CRIS. And again, those happened in July, but just wanted to make sure people felt comfortable with that. If you still have questions, we actually have a CRIS enhancement guide on our website that talks you through all of those and helps you understand the different nuances of the new subcategories. I think this last slide is just ways for you to stay connected with our office. The first link right there is so that you can get the constant contact communication. So when we announce who our new Region 2 manager is, when we announce who the training and development coordinator is, that's where we send that information. So it's important that you sign up for that. Also, our webpage has lots of resources. Again, that's where you're going to find the LHRC information and the application, the review forms. Then always important to have a link to the human rights regulations. And then my contact information is there. I have a virtual open door. Please feel free to reach out to me if you have questions. I will also stick on for a little while to see if there are questions in the chat specific to anything I've said here or the Office of Human Rights in general. And I just really appreciate the opportunity to share with you this morning.
Thank you, Tanika. Please remember to put questions for her in the chat and she'll respond. And we'll also include those in our larger question and answer report when we're done with this meeting, which you will then find on our website. Next, we have the Office of Provider Network Supports, speaking about the RST with Ashley Painter. Ashley?
Yeah, hey, good morning, everybody. I'm just here to give a few updates on the regional support teams. Just a quick reminder of where you can find the preview session from when RST went paperless and into WAMS. There is a link there for you guys. I think it's really helpful to watch that in case you have questions about how that process works. Just another reminder that in order to even begin the RST process in WAMS, a VIC is required to be completed. This is also your opportunity as a support coordinator to provide information related to the Center for Family Involvement and peer mentoring, as well as document the review of support coordination, where you can find that information under additional DD waiver options and show that the CSB was chosen, as well as list the full name of the support coordinator that was chosen. That's really important so that we can ensure that informed choice was provided. So filling the VIC out completely is always really helpful in the RST process. It's also my time to remind everybody to make sure that you are submitting referrals timely in WAMS. We do use this data to track compliance, and we're using the submission date. That's not the date that the referral was started, but it's the date that you hit save and submit in the upper right corner. So just a reminder to make sure you hit save and then you wait a couple seconds and then submit will show up in that upper right corner. Reminder to hit submit because that's what moves your referral forward to us to review. Next slide. Also, a quick reminder that you guys no longer have to call into the meetings unless we are asking for you to call in or if we're holding an emergency meeting. This gives you guys the opportunity to provide all the information that RST would need in that referral, as well as to the CRC, who is Renita Clements, who would be presenting on your behalf to the regional support team. I do send out an email that lets you know the date that your referral will be reviewed. And I also include some questions that are really helpful for us to have information about when we're reviewing your referral. So if you could just simply reply all to that email, it gives us the information that we need, and it also gives us the opportunity to ask questions about other information we might need to present on your behalf. It's also really helpful for you guys to make sure that when you're filling out the summary in WAMS that you provide all the details that would be really helpful to us. This is your chance to document medical, behavioral support needs, and also document the reason for the referral and what you're seeking from RST. So filling out that summary is always really helpful. You guys will continue to be responsible for all the recommendations. They are put into WAMS within 5 days of the review of the meeting. So like I said earlier, you do get that email from me that tells you the date that it's going to be reviewed. So if you're logging in and checking regularly, you will see when the recommendations are in the system for you to follow up on. Next slide. All right, just also a really quick reminder, if you put an RST referral into WAMS, make sure you're checking on it every once in a while. You need to be monitoring the status of the referral. We do have the ability to reopen and make requests for corrections. So if it's reopened, you need to see that it went back into the first status. So it's not there for us to review yet. There will be a note in the referral, and I typically follow up with an email that lets you know that I have reopened it and why I've reopened it. So just a quick reminder to make sure you're definitely following up on those referrals once you put them into WAMS. Don't just put them in there and forget about them. Check on them every once in a while. RST is not only used for compliance for the settlement agreement, but it also assists us with identifying gaps across all regions with services. So again, really important that you're doing them and doing them timely. I did include some information about how many referrals RST has been reviewing since January 1st and the number of referrals that remain pending by region. Pending means that there has not been any action on the recommendations and the referral hasn't been closed out yet. So as a reminder, RST referrals need to be closed or have some sort of action taken with them within 15 days. So if you guys could go in there and check on those pending referrals, that would be really helpful. I understand that not everything happens in 15 days, but if we can aim and strive for that, that would be great. Next slide. All right, and just another little bit of information. We do now have the cross-regional team called the CRT. We do meet once a month, and we are hoping to catch all the referrals that come in the transition period from when a regional agenda has gone out. This is the meeting that will hopefully catch and review those referrals that happened in that gap and get them reviewed quicker than waiting on your next meeting. So we are doing that. We are doing that monthly, and CRT has reviewed a total of 209 referrals since January 1st, 2023. And I believe that is it for me. I'll be here if you have any questions. Thank you so much.
Thank you, Ashley. And don't forget to put your questions in chat for all of our presenters so far. And as we continue for Regional Quality Council today, we'll have Brett Welsh with us that will take us through his update for this area. Brett?
Sophia, if Britt's in central office, we have to evacuate right now, so you may want to jump around on the agenda.
Okay, you just sent me
Yeah.
the text. Okay. Eric, are you having to leave?
Yeah, so I'm wondering if there's someone who could take over the slides for me.
I sent them to our entire team, so maybe Barry.
Barry, are you
Yep.
able to do that? Okay, I'm gonna stop sharing then.
All right, let me pull up slides.
All right.
Talk amongst yourselves. I'll be right there.
We apologize for this unexpected interruption. So while we're waiting for Barry to take over the slides, do you have any questions that's in chat that we can answer? Michelle, are there any questions that you're seeing that we could answer?
Hold on, let me admit someone. The one that we had was someone asking, but she wants a DMAS. Tamika has answered the other questions. I don't think there's, unless I'm missing something.
Well,
Someone wants to, is Tamika still on? Tamika, you still on? There was the question about addressing the CRISP reporting for emergency room visits. Did you answer that one? Oh, well, Tamika's probably in central office and
Tamika's
probably had to leave
central
too.
office, yeah, and has to leave as well.
Okay, hold on just a minute. Emails from Human Rights, please click the following. She answered that. I don't really, oh. Nope, that one was answered also. What an RST was, other officers, nope,
Hey,
that's all
Michelle.
answered. Yep.
Hey, it's Katie from DMAS. I don't know if this would be helpful. Amy and I were gonna do a combined presentation. But I can go ahead and start it if that would help it along. And it looks like if Christy Lambert maybe could be switched to a presentation or presenter, she is willing to help out with Britt's part, just to keep
Well-
things going.
Yeah, Katie, we have your slides included in these, so we can go to that. What I can do is if Barry is ready, Barry, you can fast forward beyond the Regional Quality Council and go to the
Okay.
next set of slides, which is the funding program, and I will read those on behalf of Heather Hines, who is
Okay.
not able to join us today. Then we'll come back. And
Right.
Katie, if they're still at the fire drill, we can move you forward into that agenda. Thank you.
Okay, yeah, no problem.
Is this where you
Okay,
want to
so-
be?
Yes, sir. Thank you.
Okay, sure.
So this funding program is in relation to the Individual and Family Support Program. And what they're wanting to share today is that they have a funding portal that's currently open to all applicants. In order to be eligible, the people on the DD waiver wait list and living in their own home or in the family's home, that's one of the eligibility. Another is that the applicants with a waitlist priority 1 status may apply for up to $1,000. Those applicants with a waitlist priority 2 and priority 3 statuses may apply for up to $500. The date by which you need to apply will be Monday, October 16th. That is passed, so hopefully you've done that. But there is an upcoming date, November 14th at 5 p.m. It is important for you to remember that the funding portal application link, which you can see here for those on the phone, if anyone, https://dbhds.virginiaspelledout.gov/IFSP online. Also important is that the funding is not awarded on a first come, first served basis. So applicants can take their time and apply anytime before November 14th. Additionally, the IFSP makes determinations based on the application reviewed criteria outlined in Section 6 of the funding program guidelines located on the My Life, My Community website. That website is https://tinyurl.com/MLMC-funding. Also important is that materials to assist applicants are also available at https://tinyurl.com/MLMC-funding, including a training video, user's guide, guidelines, FAQs, 2 pages of quick reference guide, etc. And next, we have that applicants will not need to know their waitlist priority status in order to apply. Next slide, please.
I moved it.
It's not showing me the new one. Now it is, thank you.
Okay.
Continuing, DBHDS established the Individual and Family Support Community Coordination Program in order to assist families and individuals with developmental disabilities on the DD waiver waiting list so that they may live, work, and play in their communities. The IFSP Community Coordination Program is a partnership made up of the IFSP Regional Councils. There are 5 coalitions of individuals who are on the DD waiver waiting list, family members, caregivers, or providers working at the grassroots level to increase supports in their communities. And the IFSP State Council. This is a coalition of individuals who are on the DD waiver waiting list, family members or caregivers that served as an advisory board to DBHDS. And this fall, the IFSP will begin recruiting to fill vacancies across our regional and state councils. So please visit My Life, My Community to learn more about the council's history, regions, and council members' roles. And if you have any question or might know someone who could be a good fit, please email us at ifspcommunity@dbhds.virginiaspelledout.gov. And if you have questions regarding IFSP, please also place them in the chat, and we will include those in our larger Q&A that will be posted on Provider Network Support's webpage. Next, we have Diane Gordon, who is with DMAS, to talk to us about legally responsible individual, LRI. Diane, are you with us? And hearing no response from her, could you go to the next slide, which would be Katie and Amy Britton?
There you go.
All right, this is Katie. I'll go ahead and start. We could circle back to Diane. I don't know if this is possible, but it looks like she is a participant and not, like she's not able to come off of mute. But I'll just go ahead and start. Good morning, everybody. My name is Katie Morris. I am the Quality and Service Integrity Manager at DMAS in the Division of High Need Supports, and we are responsible for oversight of the 3 DD waivers here in Virginia. Originally, I was going to be doing this presentation with Amy Britton, who is the Policy and Compliance Manager at DBHDS. She is, out in the fire drill. So I'm going to do the best I can, and I appreciate your patience. Next slide, please. So this is just a reminder that the HCBS settings rule is a federal compliance standard. All states have to reach full compliance with the settings rule and able to enable to maintain our federal reimbursement for HCBS services. Next slide, please. This is just outlining the authority to complete the audits, which is in our DD waiver regulations. It's in our statewide transition plan. And compliance with DMAS audits is also listed in provider participation agreements that are signed with DMAS. Next slide, please. So here is a little bit of an update of where we are. So as you all know, the 5 services that are being reviewed are group home residential, supported living, sponsored residential, group day settings, and group supported employment. We did ask CMS for an extension, what they are calling a cap. So under this, we have until December of 2025 to get through all of the residential reviews. And as you can see, we have about 900 left. And we have about 700 that are in progress or in a remediation status. For day settings, and this day settings heading is also inclusive of our group supported employment settings. We only have about 19 left, and there are 62 that are in progress or in remediation. And we are hopeful to have those finished well before the June of 2024 deadline.
Katie, I think I just got Christy up as a presenter, so I think she can unmute herself now if you still need her.
Oh, no, I'm good.
Okay, cool.
Next slide, please. Amy probably had some really great additional information for this slide. But since you all are stuck with me, we just wanted to go through a few myth busters that are common that we see when we are doing our HCBS reviews, where people get confused in thinking that things are mandated in other regulations, but they actually are not. So a really big one is posting menus on the refrigerator as a requirement. Another one would be making all individuals be in quote unquote line of sight at all times, when that is not what is outlined as the support that's needed in the individual's plan of care. Likewise, doing bed checks on individuals when that is also not the support that's outlined in an individual's ISP. And, blanket rules like just because an individual is receiving services, that they, under no circumstances could, smoke a cigarette or have any kind of alcohol. Again, regardless of whatever is outlined in that person's actual ISP. All right, next slide, please. So here we've just highlighted some really common areas of remediation, which a big one is not having a true understanding of the difference between HCBS rights and human rights, having documentation that does not show any choices being made by the individuals, any autonomy or independence. Documents that don't use person-centered language, things like client, resident, participant. We've even had people say, oh, we support wheelchairs here, and certainly individuals are much, much more than any kind of adaptive equipment that they utilize. As a reminder, all individuals are entitled to have keys to their bedrooms and the front door of the home. And any modification to an HCBS right has to be documented in the Part 5. We do talk a lot about excessive signage in people's homes. There are some signs that are required by licensing or the Office of Human Rights. That is not what we're talking about. We're talking about things like emails to staff policies, reminders to staff. If you are going to take time off, to put in like a leave slip, just things that would not be typical of people's homes. Next slide, please. Okay. So we included this slide because we wanted to show the similarities between what the state is finding in our reviews and what CMS has found. CMS is doing site visits for various different states. And because of this, they when they go and they do a visit to a various state, whatever findings are public record. So we have reviewed those, and this is what has been noticed in other states. So lease agreements that do not have appeal rights outlined for the individuals. Token systems where individuals get to do things for good behavior, but it's not a formalized behavior plan that individuals are in agreement to. The staff being unaware of HCBS regulations, lots of staff still wearing uniforms. And by uniforms, we said uniforms, they said scrubs, similar things. Settings having visiting hours, staff walking into individuals' rooms without asking permission or knocking. That was observed by the CMS team when they were on site. And having signs that contained like medication schedules or individuals, personal information that was posted in the home. So as you can see, there's been a lot of alignment with what we have said and what CMS has been seeing. Next slide, please. Okay. So I do want to talk just for a second about what non-compliance is, and what that means. So we are still actively working with every provider to provide an opportunity to come into compliance through working on a CAP agreement, working with your state staff, and getting to where you need to be. So if we have exhausted all options, or we have encountered providers that have just been non-responsive to their reviews, then we are left without a choice but to deem a provider non-compliant. What that means is that you will receive a formal notice as a provider that does contain appeal rights, letting you know that in 120 days, your provider participation agreement is going to be terminated. When that notification is sent, support coordinators, CSBs, and individuals are also contacted, being told of the non-compliance with the federal rule, because there could be a potential that compliance is unable to be reached and individual services could be impacted. I would like to talk right now to a very, very small subset of providers who have either not responded at all to their request for an audit or are not complying with their CAP agreement. We have received some really concerning reports from the community around support coordinators going to talk to individuals that have received this notice, to talk about their potential options, and encountering some really disturbing behavior from the staff of the provider. It is not acceptable to try to physically intimidate or verbally accost any support coordinator who is following the instructions given to them by DMAS to speak to an individual about other options. That behavior is utterly inappropriate to both the support coordinator and the individual. And I want to be very clear on this. The support coordinator is doing what is asked to do to them by DMAS. So if you, as a provider, receive a total noncompliance letter and you would like to talk about it, the entity that you need to talk to is DMAS. It is not the support coordinator who is simply doing their job. Next slide, please. As you all should be well aware by this point, full compliance is not a one-time achievement. Every provider is expected to remain in full compliance. So once this transition period ends, this does not go away. This is our system now. We have to fully comply with these regulations. The statewide transition plan, again, is available for review on the DMAS website. Next slide, please. And we do also have a toolkit that is available, again, on the DMAS website, for lots of information around the final rule and how to implement it. Next slide, please. If you have questions, you can reach out to DMAS. You could also reach out to Renita Clements, who is the designated CRC for HCBS settings. Questions? Next slide, please. Great, and I also will be around to answer any questions coming in to the chat for a few minutes.
Katie, there is one about during the HCBS audit, we were told menus needed to be on the refrigerator. Can you provide clarity? So if you want to put that in chat, that would be cool. And Diane, you should be a presenter now and should be able to bring yourself off mute.
Thank you, Michelle. Thank you, Katie. Barry, if you will go back just a few slides before the ones that you just presented, you should find the LRI information. There you are. You've gone up too far.
Thank you
Diane,
so
can-
much for unmuting me. Yes, I'm here. Hi.
Okay, cool. Just wanted to make sure I got it right. I'm
Yeah.
learning, so thank you.
Barry, go up.
Ah, okay.
Yes, up. It's slide number 24, thereabouts. No,
That's regional quality counts on my end.
yeah, go down. It's one slide. Says,
Yeah, I can't. Hold on a second. Let me expand this. Maybe I can find it this way.
I really appreciate your resiliency. There's, no one can really expect to have an entire building vacated during a big meeting like this. So thank you for for all of your hard work here.
Yeah, it was well timed.
All right.
There's C. All right. It's around here somewhere.
Yes, after the regional part.
And also, I
There
can't,
we go.
the way this
Oh.
is set up for everybody who is the participant, whoever has their hand raised, if you'll just put your question into the chat, that would be easier. I'm not sure I can find you in the 99 plus people that are on here to figure out who's got their hand raised.
Hi, everybody. My name is Diane Gordon. I'm a contract monitor with DMAS, and I joined the meeting today just to discuss a little bit about the new implementation that will be occurring next month for families of minor children and spouses who wish to continue providing attendant care. Just to give everybody a very brief overview, prior to COVID, parents of minor children and spouses were not able to provide support to the waiver individual. During COVID, an allowance came through which enabled families and parents and spouses to go ahead and provide paid attendant care. The public health emergency ended in May, and so we were given 6 months to unravel this program. We've made lots of modifications and changes, and families, parents of minor children and spouses will be able to continue providing consumer-directed and agency-directed attendant care after the end of this appendix that allowed it during COVID. The website is on here. Thank you so much, Sophia, for putting that on there. I'm also going to put something into the chat for anybody who has any questions about the LRI, Legally Responsible Individual Program, which will be implemented next month. Just to kind of give everybody a quick rundown for some FAQs. Number one, if the waiver individual is an adult, they are not impacted by any of this information unless it's their spouse who is providing support to them. So if an individual is above the age of 18 and their parent is providing them with support, they do not need to do anything differently. Another thing, just to make sure that we're being super clear about, is that regulation prohibits parents and spouses from providing support. This is an exception that is being made at the direction of the General Assembly in order to be able to extend this program. But that means that parents and spouses continue to be ineligible to provide other waiver supports. For example, in-home support. A parent cannot provide in-home support to their minor child. A spouse cannot provide in-home support to their husband or wife. So wanted to make sure I address that. And as this program moves forward, there's going to be lots and lots and lots of questions. We have an entire team over at DMAS who is committed to making this go as smooth as possible and providing as much support as we can. So I'm going to put an email address in the chat box. So anybody who has any questions, please feel free to reach out. We will be happy to provide you any support that we can. Thank you all so much.
Thank you, Diane. Would you like to see if there are any questions or just have them send them to you?
It depends on whether there's time or not. If anybody has any quick questions, I'd be happy to answer those. Otherwise, you can just send them to the chat, to the email.
Well, thank you very much.
Sure.
Eric, we can now go to Regional Quality Council, and we'll see if Brett is back. Eric is back with us, so Brett may be in his office. If not, we can present that information on his behalf.
I did put someone else as a presenter. Who did I put as the presenter that said that they would do it for Brett? If he's
Christy.
not, okay. Christy, if you are there and Brett's not there, you are unmuted now, I think. I think I made you a presenter. Maybe.
It says she's not unmuted. Oh, Brett says he'll be back in a moment.
Okay, let me see if I can find.
And for those of you, while we're sorting this out, I appreciate your patience. We did not anticipate a fire drill at central office, so it caused an evacuation for some of our presenters. But when we sent out the agenda, we had a lot of reminders at the end of the agenda. We hope that you read those. And this would be a time where if you did read and had questions, you can put those questions in chat while we're sorting out the next presenter. And we can try to answer those questions on your behalf or someone that you may be speaking for.
Christy is now a presenter, so she is available. She should be able to unmute. Sorry, I thought I did it before, but I got her there now. She's on the list.
Yeah, and Britt's back too. I think I just fixed his mic
Okay.
as well.
Hi, Christy. I don't know if you're on or not, but I'll go ahead and cover. So I'm pinch hitting for Ramona DeFonza. She is the quality improvement specialist for Region 2, and we just want to provide you with a couple of brief updates here. Could we go to the next slide, please? So first off, we have vacancies on our regional quality councils. The RQCs were an outgrowth of the settlement agreement, but we're also a subcommittee of the State Quality Improvement Committee. Our charge is to identify and address risk of harm. We also work to ensure the sufficiency and quality of services to meet individuals' needs, specifically in integrated settings. And then to do that, we evaluate state and available regional data that's tied specifically to the performance measure indicators, otherwise known as PMIs. And then we're monitoring those to ensure that we have ongoing continuous quality improvement. Next slide, please. The membership of RQCs, we have 5 RQCs, 1 in each region, and all of the RQCs include the following members and family members. We have day service provider representation, support coordinators and case managers. We have a QA, QI folks from private providers, residential service providers, of course, individuals receiving services. We have Community Service Board DD directors represented. We have quality assurance, quality improvement representation from the CSBs. We have crisis service representation and employment service representation. Next slide, please. Currently, we have the following vacancies. In Region 1, we're in need of a family member or an individual receiving services or on the wait list. If you know of somebody or that you think would be interested in serving, I ask that you please reach out to Jamie Roop at jamie.roop@dbhts.virginia.gov. Jamie is the Quality Improvement Specialist for Region 1. In Region 2, we are in need of an individual receiving services or on the wait list. I ask that you reach out to Ramona DeFonza. She's the QI Specialist for Region 2. In Region 3, the Southwest region, we have needs for a day service provider, an individual receiving services or on the wait list, family member or an individual receiving services or on the wait list, employment provider. And I would ask that you reach out to Christy Lambert, who is the QI specialist for Region 3. In Region 4, we're in need of an employment services provider, support coordinator or case manager. And I ask that you reach out to Pebbles Brown, who is our QI specialist for Region 4. And then finally, in Region 5, we have need for a crisis service provider, and I ask that you reach out to Ramona DeFonza. The reason formerly we had Julie Palmer was our QI specialist for Region 5, and she took a new job, so we are currently recruiting for her position, and that is the reason that we have Ramona, who's pinch hitting in that respect for Julie for that vacated position. Next slide, please. Also wanted to talk to y'all a little bit about our consultation and technical assistance that we provide for Regulation 620.C.2. We've been doing the consultation throughout the year. The next time for sign up, we'll be sending out a notice through the provider listserv. But that will be the week of December 18th, or 2 weeks rather, December 18th through the 29th. So be looking for that to show up on the listserv at that time. OCQI will notify providers of the sign up, of course, via the DD listserv, and then we'll provide our CTA for calendar year 24, starting in Q1. So that would be January through March. And I think that might be the end of my slides. Do we have some questions there that maybe I just missed as I was going through the slides? Kenneth, Bobby, is that question addressed to me? Yes. So we don't have a specific position for a therapeutic consultant. If you wanted to touch base, I don't know what region you're in, but if you wanted to touch base with that QI specialist for the region that you work in, there'd be some other questions that we could ask you specifically. Are there other roles that you're serving for your organization that might tie into those positions that we have vacancies for? In other words, we have some people on the committee that they might be serving 2 roles within their organization, but one of those roles meets a vacancy for a position or member or alternate position that we have. You're welcome, Bobby. Any other questions?
Thank you. Brett, that brings us to the end of our presentations, and now we can do our Q&A program. So, Barry, you could put us back to the provider roundtable slide, please. And Michelle, are there any questions, or Nidra or Dorcas, that you're seeing, anyone from the CRC team that we can try to answer now?
I think most of the ones that I've been seeing have been answered. Who has their hand up right this moment?
It's Dave Taylor.
Dave, if you can put it into chat, that would be easiest. And we would be glad to answer whatever it is. Someone wants to address the reporting, the CRISP reporting for emergency room visits. Is there a chance that that might change? Urgent care is in our area is now requiring appointments, so people are going to the ER in lieu of the urgent care to see a doctor for non-urgent matters when they can't get an appointment there either. Is there somebody who can? We'll have to, I think.
Yeah, I think we'll have to defer that to licensing and human rights. So
Yeah,
we'll include that in the Q&A afterwards.
Thank you for your question.
I think someone please throw it in the chat if I've missed your question somewhere, but I think we were answering them as we went along.
So there is a question in the chat from Dave. Are day support services required to meet statewide performance standard? I was cited in round 5 for this.
Dave, yes, that was answered. Heather answered it as yes.
There is another question in the chat. Is an unplanned visit to urgent care an incident 1 or 2, and that is a licensing question?
Yep. Please give an example of a centered and non-centered based day support service. I mean, when you're asking for an example, can you give us a little bit more? Because, you know, centered based day supports are there. They're actually in a building in a center, whereas non-centered based day supports are not. And I don't want to get too much into that one without someone who actually works with those regs. If you wanted to reach out to one of your CRCs, we'd be glad to help you with that. There's another question. We're having issues in Region 4 with getting some positions to assist with creating or even reviewing and signing off on health protocols. What is the suggested workaround?
For that
So-
one, I would have them contact their nurse care coordinator for the region in the Office of Integrated Health. Depending on the region, which one it is. And if you don't know, you can contact the CRC for your region. We can help you.
Nicole Williams wants to know, where do we find the statewide performance measure to include in quality improvement report? Because the data I found only dates to 2021.
Heather
Oh.
answered that one, Michelle.
Heather answered that one. Sorry, I didn't go far enough down. Can an AR live in a home with an individual, with the individual? Can an AR that lives in the home with the individual provide services? And can somebody let people in who are waiting in the lobby, please?
I think that might be a question for me, perhaps?
Yes. I think
Okay,
you-
perfect. So, if the individual is, I'm assuming that the individual is not a child, if it's an authorized representative and not a legal guardian. So what I would say to this is it depends on what service you're referring to. An AR for an adult individual who is on the waiver could potentially be able to provide services if objective written documentation is provided. And again, it would, okay, he's an adult, he is in-home services. Okay, thank you very much, Victory. I appreciate that clarification. So in-home support services is meant to supplement the care of the primary caregiver. So if the AR is the primary caregiver, that gets kind of tricky because they can't supplement their own care. If a family member who resides in the same home as the individual is hired to provide care, there would need to be objective written documentation to support that person being hired. It's a nuanced kind of system. So, unfortunately, everything is individualized, and I can't answer your question with a definitive yes or no. But what I would do is get in contact with either the CRC or the support coordinator, and we can look at that particular situation in more detail.
Go to chat.
Someone is asking if the questions on the myth buster list are those things that are,
Katie just answered that one.
okay.
I don't see anything that's new. Oh, wait, just as I say that, they pop up a new one. Ebony says we're considering decreasing our license from 5 individuals in each ICF home to 4. What steps would need to be taken? Does anybody know the question about the ICFs, or who we need to send it to?
Yeah, so for ICFs, I mean, we'll have to get additional support with that, but my understanding is that there are a couple of licenses involved with ICFs. So the modification process might be a little bit more involved than it typically would be for like a group home. Because I believe we are talking about the Department of Health as well as DBHTS. So if you want, if you can send me an email, we'll get you connected with someone who can support you with that.
Eric, they're gonna.
Yeah. Michelle, did you say something?
I was just saying, make sure you put your email in the chat, Eric,
Oh.
because that's going to be the next thing they ask. And then
Okay.
Sophia, there's like several questions about, do we have access to the slides from this meeting?
Yes, you will have access to the slides, and we'll also combine the questions from the chat and the answers. And if there were any questions that we missed, we'll find answers for those from the presenters that are not on the call at this time, and we'll combine those and get those back out to everyone. They'll also be on our website. That's where you'll find it. Office of Provider Network Supports. Someone was asking about the PREP program. Is Jen on?
I don't think she is. Is there a specific question about it, provider readiness and education program?
Erica, if you're still on, that was your question. You can type more information for us.
Yeah, I was just going to provide a brief update on that. Jen is working on stepping up those sessions to hold sort of a modified prep training monthly instead of semi-annually. So that might be an option coming soon. And as soon as that's available, we'll announce that through the listserv so that more folks can participate.
I wanted this, Barry, just kind of point out for everybody that's on here still, there are two different listservs. There's one through the Office of Provider Network Supports, which is the CRC group primarily, and then there's one for licensing human rights. It covers both those offices. You need to register for both if you're interested in receiving notifications from each of those. And you do that on the DBHDS website.
We have a couple of more. What time frame? What is the time frame that a provider can apply for service modification if a provider was recently approved for a location modification? That would be licensing, and we will have to refer that. Are they on? Okay, we'll have to refer that one. And Dorcas answered where to find the slides from previous roundtables.
No, I just sent the CLC contact information.
Okay.
There was a question about whom to contact for questions, so I sent the contact.
Thank you, Dorcas.
Yeah.
So will the slides and information for previous roundtables meeting be put on the DBHDS website?
So they're already there. Sophia, would it be helpful to just take a minute and show the website so folks know how to get to things?
Yes, thanks.
Yeah, I'll do that.
Someone has a question about COVLC registration and the response time frame from DBHDS to complete required trainings. I'm not sure what the question is, but Calvin, there we go. Nancy says they're only up to January on the website. And Calvin,
Okay.
I'm not sure what question you're asking. Do you just need to reach out to someone? If you could put that in the chat and let us know.
Yeah, so I'll just show real quick for folks who aren't familiar with the sections of the website that we work with in Provider Network Supports. There are actually 3 sections. If you go under Getting Help, you're going to see Provider Network Supports, which is our primary page. But you're also going to see Support Coordination Case Management Resources at the top, and then you're going to see Centralized Training for Providers at the bottom. So what we'll do, we'll make sure and get the most recent roundtables loaded onto our primary page right here under Provider Roundtables. So we'll get those updated. Other things on here related to the provider data summary, jumpstart funding, the regional support teams, training and resources, and ISP guidance. If you're interested in finding information about the competencies and DSP supervisory training, you would go to Centralized Training for Providers, and you would look under Required Training. So we have required, recommended, and resources and peer mentoring. If you go under required, the first thing you're going to see is a section that completely covers the orientation, training, and competencies process. And then finally, for support coordinators, you would want to go to support coordination case management, and you would want to select SCCMDD specific. And here you're going to find information like the SC handbook, which is currently headed for public comment with some revisions, information about enhanced case management, and then the various tools that are employed to assess for risk and change in status and crisis possibility of crisis events. So I'll go ahead and stop sharing, but that gives you an idea about the 3 areas where you can find information related to our office.
Okay, it says we can no longer solve. Oh, sorry, Sophia, there's a post about, and I'm sorry, it was actually posted twice. We can no longer self-register on the COVLC website. Is there a new process for that now? I just discovered yesterday.
Yeah,
there a new-
if you go to the centralized training for providers that I just showed and select required training, there is a lengthy narrative at the bottom of that section that talks you through how to register in the absence of self-registration. So those instructions are included on the website currently under that section.
Calvin had the question is, yes, the question is, who do I contact in regards to registration from the DBHDS if and I lost it. If no one has responded to the email.
So can you clarify what registration you're referring to?
Heather just asked.
Oh, okay.
Well,
thank you.
and I think, did I miss anything? Anybody else that's watching the chat? And I apologize if I didn't catch something.
I think that's it.
All right, so we're not going to keep folks on longer than we need to. You know, we'll stay on and leave the line open for a few minutes if you have lingering questions that you want to make sure make it into the Q&A. We'll leave the channel open. You can drop those in, and we will send these slides, the recording, and the Q&A out as soon as possible and get those posted on the website as well on the Provider Networks page if you need it. Sophia, I don't know if you have anything else you want to share.
No, Eric, I have no other information to share, but we do thank all of you for your patience today. That was an unusual meeting, but I think it still went pretty smoothly. So thank you. Don't forget, you can contact your regional CRC if you have additional questions, and we'll either answer or send it to the correct department for an answer. Thank you and take care. Have a great day.